Hi friends, I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about wisdom teeth and TMJ disorders. I'm part of multiple TMJD support groups online, and I've seen many people ask questions about wisdom teeth and TMJD. If wisdom teeth can cause TMJD, if you should get your wisdom teeth out while suffering from TMJD, and more. These questions, these comments, they inspired me to make this video in hopes of providing some answers for you guys. That being said, if you're looking for more information on TMJ disorders for yourself or a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button as I post a new video every Friday for people that are suffering from TMJ disorders. For those of you who don't know who I am, I'm a general dentist with a practice in Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. I practice here with my wonderful mentor, Dr. Arthur L. Parker. If you haven't already, be sure to check out our website. Please be sure to follow me on Instagram as I post about TMJD frequently, at least 3 to 4 times a week. My Instagram handle is the_TMJ_doc. Also follow me on Twitter, tweet. My handle there is @PriyaTMJ. I post lots of useful information on TMJ disorders, tips, trivia, etc. for those of you who like to nerd out on TMJ knowledge like I do. So let's get right into it. Wisdom teeth, also commonly called third molars, start erupting into our mouths usually around the age of 17. For many of us, these teeth are actually impacted, which means that they are stuck in the bone or in the gums. If this is the case and there's a chance that the wisdom teeth can cause damage to the adjacent bone or the teeth in front of them, the second molars, then many dentists will recommend extracting the wisdom teeth. Another reason wisdom teeth are commonly extracted is due to infection. Many people who are suffering acutely from TMJ disorders are very hesitant to get their wisdom teeth out because they are afraid that the pain will get worse. And I will say this is a valid concern. If there's no infection or pain being caused specifically by the wisdom teeth, then I would recommend treating the TMJD first. This means eliminating pain and stabilizing the temporomandibular joints, the TMJs. We treat with orthotics, myofascial release, and osteopathic manual jaw manipulation. With this treatment modality, we can typically get our patients relief and release them from active treatment within 4 to 6 months. Sometimes we can do this faster, sometimes it takes longer, depending on the severity of the problem. Fully erupted wisdom teeth, teeth that are in the mouth and used for chewing, can potentially cause occlusal interferences, which then exacerbate TMJD symptoms. What that means in plain English is that the way the wisdom teeth bite against each other can put too much strain or stress on the temporomandibular joints and the muscles that surround and support the jaw. This can then lead to TMJ problems, clicking, popping, crackling noises, episodes of the jaw locking, headaches, neck pain, jaw pain, ear pain, and more. So what to do? Do we extract the wisdom teeth because of this? Do we adjust the bite on the wisdom teeth? Remove enough enamel so that those occlusal interferences are eliminated? Well, actually, you might be surprised to find out that at my practice, we do neither. If these wisdom teeth are fully erupted and healthy and infection-free, we don't recommend extracting them. We recommend holding on to them. We eliminate the negative influence of the bite by making a TMJ orthotic. A TMJ orthotic, if made correctly, will take the occlusion or the bite out of the equation and treat the muscles and joints effectively. Once an orthotic is worn for a significant amount of time and our patients have followed through with our weekly treatments of myofascial release and osteopathic manual jaw manipulation, we find that the muscles and the TMJs are brought back to health and we can then release our patients from active treatment. Most patients will continue to wear the orthotic at nighttime only to keep them out of trouble. We've found that 7 to 8 consecutive hours of wearing it at night will set our patients up for success the next day. And then same thing, when they go to bed the next night, they wear it for 7 or 8 hours, it sets them up for success the next day, and so on and so forth. Lastly, I wanted to address TMJ problems that begin after wisdom teeth are extracted. Unfortunately, I've seen this many times. What happens with wisdom teeth extractions is that the mouth is held or propped open by a very large bite block. It has to be held open this much for the dentist to actually reach the wisdom teeth because of how far back they are. Along with that, some wisdom teeth are very difficult to extract. They may have big cavities, they may be situated at awkward angles, or the roots might be wrapped around a nerve. If any of these are the case, then the extractions may take a long time. The mouth being held open very wide for a long period of time is not great for the temporomandibular joints or the muscles that surround and support the jaw. One thing that can happen is that the cartilaginous disc within the joint can become completely displaced, causing the jaw to lock closed. Another thing that can happen is that the ligaments holding the disc in place can become loose or stretched. This then causes that cartilaginous disc to become slightly displaced, causing clicking and popping noises. The muscles can also get strained from staying open for such a long period of time, leading to muscle inflammation and pain. I've seen all of these situations at my private practice. If this occurs, the best thing to do is to get the patient into treatment as soon as possible with the orthotics, the myofascial release, and the jaw manipulation. I want to be very clear that I am not blaming oral surgeons, dentists, or anybody else that might be out there extracting wisdom teeth. These things happen, and this video is purely informative. So that's really it, my friends. If you like what you heard, if you learned something new, click like below, subscribe to my channel, do all the things. As always, questions and comments are welcome. And remember, my friends, you can never have TMI without TMJ. Thank you.